Welcome to our page on back pain. Before I explain the cause of back pain, I wanted to share a couple statistics with you that I find quite interesting. Number one is 90% of us will experience back pain in our lifetime, and 50% will have multiple episodes of back pain in their lifetime. About $60 billion is spent per year on the treatment of back pain. Medically, when people go in to get checked, they have no explanation why they have back pain. And then the other interesting thing is it's the most common reason that people miss work other than the common cold. It has the highest incidence of disability, and also, finally, when people go to the doctor or the emergency room, the number one reason is because of back pain. So, as you can understand, it is something that is quite serious. Now, what I want to explain, since people don't understand why they go to the doctor, and the doctor oftentimes, when you do see them, they'll say that you have a muscle strain or muscle pain, and that is part of the condition. But in our office, we specialize in the treatment of back pain. And in our experience, after 25 years seeing thousands of patients and looking at, when necessary, hundreds of x-rays, we have noticed that, and this happens with aging anyway, is the spine will degenerate. And why does it degenerate and make it prone to having a disc rupture or disc herniation? And what I'll start with is a segment of the spine, and the segment of the spine is made up of two vertebrae, and in between the vertebra is a pad. The center of the pad is a gelatinous material, almost like jello, and then it has these annular fibers around it. And what the pad is necessary for is to give plenty of room for the nerve to pass through. But what will happen, and when we get a good history, we find out why you have experienced back pain. Oftentimes it can be something that's happened to you when you were really young. It only takes one incident to have a problem that will show up much later in life. And why it is because the spine has to be real mobile and functional. But if we have a number of incidents, or one major incident, or some type of repetitive type of job or repetitive stress like sitting, what happens is the spine will not have its mobility or its motion. In chiropractic, we like to call it a subluxation. You just need to know that what happens is the spine loses its motion, its function, and its alignment. The spine will begin to degenerate, the nerve will get irritated, and this will be causing, depending upon what you do, it'll cause you episodes of back pain. So here at Dr. Valentine's office, we will let you know if we can help you or not, and we will find the cause of your problem.